in there I put in also, that's where I was first heavily poisoned, besides the house painting I used to do with mercury, with my 7 vaccinations in one day, all filled with mercury, which permanently altered my immune system, and which fired a kind of passion. In the 1920s, when they gave mercury to the syphilitics, the doctors noted that the initial effects were salutary. If people were a little dull and phlegmatic, it lit them up. It made them much more passionate about life. So I've had a very passionate career seeking the truth, and always with an imbalanced immune system ever since then. And I've kind of almost figured out how to restore balance. And one of the really earth-shattering things that happened 2 or 3 years ago intellectually is I decided that plaque forming in the mouth every day wasn't normal. Even though that's what all the advertisements say. Plaque forms in your mouth every day, therefore you must brush and floss and see your dentist twice a year. We all know that one. But I decided that actually plaque formation was failed cellular immunity. And in my simple model, there's just 2 layers of immunity. Cellular immunity, which is effective and takes care of everything quietly, and we never even know we're sick. And then if that fails, then the body turns on humoral immunity. That's allergies, hay fever, all the bad stuff, and autoimmune disease. If we can restore cellular immunity, then all that bad stuff kind of goes away. And we'll tell you the basic switch is this thing called glutathione. So that's something called the septic switch. So if somebody is coming into your office and they have a toothache, they have an infection, they're having an emotional crisis, they probably don't have any glutathione. I have on the counter with a few of my extra books something called the lingual ascorbic acid test, and where you can order it. And I believe that is now the reduced glutathione test. Now I'm going to go through all these slides with you, but after the slides in your handout, there's a couple of written things. And one of those is called AGES, Advanced Glycosylation End Products. Don't look at them now. Don't look at them now. And another one describes the lingual ascorbic acid test as the instant reduced glutathione test that we've all been looking for, because that's the septic switch. And you never want to enter into a therapeutic endeavor with a patient if their glutathione is exhausted. It doesn't matter what it was last week. It only matters right there when you're sitting there with the patient. And this gives you an instant tissue level of glutathione as well as vitamin C, because they're both hydrogen ion donors. So anyway, just to give you a little warm up there, and we'll start with the slides and try to get through those. And the little pieces in the back, I think, will stand on their own and really help flesh out a lot of these new concepts, the way they all fit together into the new age of medicine. And viewing, and all the lecturers the last couple of days seem to have been, making it much easier for me to give this lecture, because a lot of this, I can just pass over some of these slides a lot more quickly because of the fine work that's already been done. Yeah. Okay. So, the basic is we all have to remember we're different. This is really a key and a kind of a confounding thing in working with people. And there's always a different time as well. We're all different, and the times are always different. And I think the mistakes a lot of people doing measuring metabolic typing and all other kinds of things, Harold Crystal, one of my favorite teachers, certain foods were acidic sometimes and alkaline other times in different people. Well, maybe it was more the different times of the day. So here we're going to start using caries in this new model, and caries is a breakdown of cellular immunity and increased humoral immunity response at high stress times in people's lives. Enamel decay occurs primarily in the pubertal growth spurt and in the second biggest program stress in people's life, ages 5 to 7. And then the next decay we really see is what we call root decay in people of retirement age, which is more of a autoimmune degeneration. And it all seems to be related to plaque. And what what we found is that iodine is the single most wonderful thing for treating caries. It just stops it. The kids don't even mind the taste of it too much. We paint it on with one of those little tiny brushes that we paint on bonding agents with. And we teach the mothers how to do it, usually once a week for the first month, and then once a month after that. And just paint it right on the caries, and usually we can wait till the kids are a little bit bigger or whatever. We don't have to hospitalize them and anesthetize them to take care of all those cavities of those early ages. And you know, if there's enough iodine around in our bodies, there'd be a third less cancer, just like enough vitamin D. Those are the two natural things that have really been coming out. If there's enough vitamin D in everybody, enough iodine, there'd be 2/3 less cancer in this country, just for example. And iodine is exquisitely important for detoxifying metals, like mercury and lead. That you have to have that on board. And that makes all your hormones work. So you can't detoxify the fluorine, chlorine, and bromine without the iodine either. And the bad rap that iodine gets because of its side effects are because of the detoxification that's allowed of chlorine, bromine, and fluorine when you take iodine. So I have a 27-page monograph on iodine I've been working on, and if anybody wants it, you can email me, and I'll email it to you. So here we go with the iodine, and this is actually in the conventional dental literature, although it's pretty much ignored. And then green tea. Green tea is amazingly antibacterial and wonderful for gum disease and tooth decay. So they put it in toothpaste, and you can use it, even drink green tea. Or you can soak your rice in green tea. Green tea has about 8 different mechanisms by which it defeats cancer of all kinds and corrects the underlying metabolism of cancer, what I call metabolic syndrome X, or the stress syndrome. And this is the slide about glutathione. And basically, a geographer named Harold Foster figured this out by looking at Africa, and he found that the penetrance of AIDS in Senegal, in Africa, is 1%, where it's as much as 30 and 40% in pretty much all the African countries. Thank you. And when he analyzed geographically, he found that Senegal has very, very high levels of selenium in the soil. Then we look back at studies I've seen from the western United States in areas of Utah and New Mexico where they have very high levels of selenium in the soil. In fact, so high that the cattle get something called falling down disease. And so you've got to be careful of selenium. But the people that live in that area have half the death rate of heart disease or cancer of people in Chicago. So, and the vegetable or fruit that grows on soil depends, it doesn't care whether there's selenium in the soil or not. It just reflects the selenium in the soil. So you cannot depend on food tables, to know your selenium source. The only dependable food source for selenium is Brazil nuts. But now they're actually planting a lot of Brazil nut plantations on areas that do not have selenium. They're still not to market yet, but in a few years they'll be to market. And then that even, anyway, you're better off taking a selenium supplement. It's 200 micrograms a day. A 1999 article in the Journal of the American Medical Association, they gave about 3,500 people for about 4 years 200 micrograms of selenium a day for skin cancer. At the end of the study, no difference in their skin cancers. But the death rate from all causes had dropped by 50%. This cost 10 cents a day, and the author said, well, somebody should repeat the study, but it never has been. So selenium makes the most active form of glutathione. There are many forms of glutathione, and selenium charges it up the best, the most dramatically. And of course, we learned in the last couple of days that mercury really ties up selenium. And mercury also disables an enzyme called methionine reductase, which is another key enzyme in recycling glutathione. So this is the septic switch. Why, when you give people N-acetylcysteine, do they need to gamble less? Well, their addictive behaviors go away. Because they're restoring glutathione. It's so central to everything. We make half our body weight in ATP every day, adenosine triphosphate. We keep putting these phosphoruses on adenosine, and it's a coiled little chemical spring, and it can release energy. And but we need 3 glutathiones to make every ATP. So when that system starts to flag, we get into trouble. Now, the system has incredible plasticity. There are 3 genetic pathways to make glutathione. And so we find this a lot when we try to, the body is incredibly adaptable, or our genes are incredibly adaptable. And another name for this is the thiol switch, because glutathione basically holds sulfur. You have to have that sulfur-containing amino acid. That is the rate-limiting amino acid for glutathione production. Mostly cysteine, and N-acetylcysteine is a little bit more easily absorbed for most people. And the other amino acid really, really important for it is glutamine. Now, let's say you're short of cysteine, you've run out, you haven't eaten your broccoli, you don't like those broccoli things, those sulfury things, and so you can't make glutathione anymore, so you can't defend yourself against inflammation. And oh, by the way, the gobbler cell, the white blood cell, will not gobble if there's not enough glutathione, because when the white blood cell gobbles, it actually increases its metabolism 1,000 times and releases peroxides and hypochlorites, strong bleaches. And if it can't protect itself against its own bleach, it won't work. It goes to sleep. And that's destroys cellular immunity. The first sign of that is dental plaque accumulating on our teeth. Okay. And there's 2 really key things to control the plaque. One is the gobbler cell, and the other is amylase. Why is there amylase in saliva? It's to digest the structure of plaque. It's a starchy proteoglycan structure. So when people's pancreas gets exhausted, all their other glands are exhausted too. And they're not making enough amylase. And that's the other thing that allows. So in pancreatic exhaustion is the underlying cause of cancer and just about everything else bad. So all this immune system, but if you're born with defective white blood cells, you get less caries. So that's a sign that it is indeed an autoimmune disease. You have to have an intact, fully functioning immune system to get tooth decay. You just have to abuse your immune system to get it. But so it is an immune-driven process. Tooth decay is an autoimmune destruction of things, very much like a joint melts away in rheumatoid arthritis. And there just was another article this last month showing the similar cytokines between periodontal disease and rheumatoid arthritis. This is another classic sign of tooth decay, and something that we see over and over again, but we never see. Look at the tongue on this kid with the big erosive tooth decay right down the middle. See all those strawberry spots on the tongue? Can you see the strawberry spots on his tongue? Okay. Now, really healthy people, you can't see any strawberry spots. They just, really healthy people, they don't have any strawberry spots. They just have nice shag carpeting, right? So what's the difference? And this is really an important concept, and I talk about this concept in the Ages article. It's called apoptosis. This is the single most new important concept in medicine. We used to think that cells only died by necrosis, and they released all their innards and they create a lot of inflammation, just the way it was described yesterday. But cells can also die by apoptosis, and that's when the other white blood cells, they actually decompartmentalize themselves, and all the good stuff is saved, and they just get rid of the bad stuff. And this is how you get rid of the webs between your fingers when you're in utero. This is how the cells die over an erupting tooth. Okay, some kids, teething is easy, right? And some kids, teething is hard, right? So the ones that teething is hard, they're getting so much stress messaging now that this normal apoptosis is being canceled. These cells are now living on. So if you get too much stress messaging, the normal way that the body processes cell death is compromised, and cells that are supposed to die don't die on time. So this creates acute inflammation becomes then chronic inflammation. A small little defective cell that's supposed to commit cell suicide grows into a tumor or a cancer. A woman whose egg is not fertilized on that day that the egg is fertile, the endometrium, which has been made to be a bed for the egg, those cells are sent a message to die on time. If they die on time, the lady has a cycle that's 28 and 3. But if those cells, if she's getting too much stress messaging, that endometrium doesn't die on time. And those hormones are prolonged, the cycle is prolonged, and everything gets out of kilter. It's a very sensitive indicator, just like the tongue, of the overall messaging we're giving to our body. Because the body wants to live. If it's getting too much stress messaging, it triages. A lot of people, it triages, so it has to let structure wane. Muscles, bones, skin, and teeth wane, and it hangs on to survival cells. The number one survival cell of all time is the fat cell. So we get flabby. We get the waving muscle. We get thick around the middle. We get fat on the back. Those are the patients, we have to give the extra pillow to because there's so much fat on their back that their head doesn't come anywhere close to the dental chair. So it's all about stress and abundance. The messaging we're giving our genes and how we change them. This is a complicated slide talking about caries being an antigenic process and that the root cause is that the lipopolysaccharide, the cell wall of strep mutans, mimics endotoxin, which in our body is a molecule of tremendous alarm. And so this creates the over-response of the tooth to create a very strong alkaline outflow, and the tooth dissolves from the inside out. So this is out of a dermatology textbook, and this is the concept of apoptosis in order to form a pimple. And that's when I describe tooth decay to my patients, I say your tooth has a pimple. And so you'll be able to digest these later. And then this picture I've shown to my patients 1,000 times. And I described the flow of the teeth. And this was originally described by Steinman from Loma Linda in 1947. But in the tides, and we'll show you the rhythms of the tides, in the incoming tide, when the body is taking in minerals and depositing them in the bones, the serous fluid carries water and minerals, deposits the minerals in the dentin, and then the serous fluid is excreted through tiny pores in the enamel. The tooth sweats, so to speak. And so I say in health, if you're in tidal rhythm, the tooth is flushed from the inside out twice a day. Nothing can stick to it. But on the other hand, during our stress states, the body takes minerals out of the bones and puts them in the blood so we can run far and fast from the saber-toothed tiger. The future is damned. We just have to survive the instant. And now the flow is going the other way. And the strep mutans, which is an acid-loving bacteria that's adapted to live in this highly acid environment, which is actually our defense against bacteria. Most bacteria can't live in an acid environment. Strep is really special. It's got these special adaptive characteristics. And if it's especially sticky, and if we stress the staph a lot, it makes more lipopolysaccharides in the cell membrane. And those are drawn with the lymph and touch the nerve of the tooth. And if we're at the time we're making a lot of pimples, which is when we get most of our cavities, the tooth makes a pimple from the inside out, trying to ward off this bad information coming in from the outside. Because the tooth at those ages is pretty porous. This is the actual rhythm. This is a veterinarian slide from the 1930s. Basically, we're most alkaline 3 to 5 o'clock in the afternoon, 3 to 5 o'clock in the morning. And it's important for the body to get more acid from about 5 o'clock in the morning till about 9:30 in the morning. Now these tides, after much reflection, really are the tides. But the tides our default for tides is 24.8 hours because our metabolisms evolved when we were sponges in the ocean, called, stomachs in the ocean called sponges. The incoming tide bringing in food, and we build and repair, and the outgoing tide taking away waste as we break down and excrete. We're not much more sophisticated than that. And if we get out of that tidal rhythm, then we're swimming against the tide, and our currents are muddied, and we can't detoxify. This is the basic detoxification rhythm. If we get off this rhythm, we can't detoxify. It doesn't matter which ones we're taking. And if we get on this rhythm, it hardly matters which detoxicants we take. That first upward surge from like 5 o'clock in the morning to 9:30 in the morning, the body's getting more acid, and we call that anabolic. Acidic tends to free up things, dissolves the minerals. Everybody feels better when they're acid. They feel crappy when they're alkaline, because when you're alkaline, it ties up your minerals. They're less available. That's why irritable and cranky and crabby. People slip into an acidotic diabetic coma. When they're acid, very, very acid, they slip away. Nobody even notices them. It's the alkaline people that are cranky and irritable. And alkalinity can be caused by an extreme vegetarian diet, or it can be caused by inflammation. In my first book, in trying to divine things, I was a TMJ expert, and I noticed that I had two categories of TMJ patients. What I called the muscular ones, the kind of easy ones, that a little bite adjusting, a little this, a little that. Man, they were well. They just had some headaches and stuff. But then there was about 10% of them that were really different. And in fact, I remember one was sitting in my dental chair. She said, "Oh no, I'm getting one," like that. And all the color left her face. She began to tremble. She got dizzy. This was something really different. I got so good at adjusting bites and everything that I could make people really orthopedically comfortable and take away headaches left and right. But I had all these patients that had terrible bites that were just happy as clams. And after a while, I began to wonder if I was curing a syndrome or if I was just taking away some symptoms of something that was more important underlying that. And we didn't know where the irritability, the extra stuff was coming from. And in the end, I finally decided it was coming not from the brain, not from the hypothalamus, but from every cell in the body. Every cell was irritable. And then after doing this for some years, I read some children's psychiatry stuff and found that irritability, physiologic irritability in psychiatry is synonymous with depression. And that's an old stuff. Today, it's synonymous with bipolar disorder. Irritability. But basically, if we're irritable or edgy, we don't have quite all the energy we need, we're not happy. We got to pay attention. We got to survive. We can't think about being happy. So, and the first sign of this is sensitive teeth. The common symptom that, let's just kill all the roots so they don't feel those sensitive teeth. Let's just cover all those roots so they don't feel the sensitive teeth. I say, you're lucky. You have a barometer. When your teeth are sensitive, they're telling you, go home and take your multi-mineral pill and a glass of water. And then you won't be bitchy and cranky to everybody else. Because when you're irritable, we take all of life's little problems and make big ones out of them. Hans Selye said, it's not the amount of stress you have that counts. It's how you respond to it. So people, when we do the vitality testing to check electrically to see if those nerves are alive or not, some people, they text, before you even get to the teens, they're jumping up and down. And then other people, you have to get to the 30s and 40s before they kind of notice the electricity. Well, the people that jump up and down really soon, that respond much more quickly to the electrical pulp tester, they're much more likely to be clinically depressed and much more likely to commit suicide. So it's we want to. So one thing you don't want to be all the time is irritable. You don't want to be acting like a rotten teenager, or a dieting woman, or a cranky old person. Now the flip side of that's basically irritability is caused by not enough good minerals, not enough water. The flip side is toxic heavy metals clog up where all the good minerals are supposed to fit. But if you really look, it's hard to find symptoms from heavy metals if somebody is not also low in their good minerals. So their first responsibility in any detoxification program, in any handling of any of these minerals, is make sure they have some good extra minerals every morning and every night. In a green juice, in a multi-mineral pill, but something in civilization, we need extra minerals. It's foundational. We need extra minerals every morning and night. Stress makes the body a sieve for minerals. You just can't hold them. The next loss of grace is uncontrolled inflammation. That was the lady that was losing it when she was getting her vascular immune response kind of headache. And all headaches really are the same. They're all, there are no nerve fibers in nerve. There's no nerve fibers in muscle. All those pain fibers, those nociceptive fibers, are inside arteries, reading the chemistry inside the arterial wall. And so if you have a migraine headache, well, you have a big vessel that's in spasm. And if you have a tension headache, you have a whole bunch of little vessels that are in spasm. But it's all coming from the vessels. It's coming from the chemistry inside the vessels. And uncontrolled inflammation is simply finding and identifying and eliminating immune triggers. And we like the blood type diet a lot as a starting list. And then balancing dietary fats. The current recommendation is the best level of supplementing with fatty acids is 2/3 EPA-DHA and 1/3 GLA. If you take a whole lot of the fish oils, you can actually depress this important the GLA, which goes into the prostaglandin 1. So that's the latest protocol in the last couple of years. So identifying and eliminate immune triggers, balance dietary fats, and then you take enough antioxidants to quench the fire. And basically, antioxidants are really safe, and you can take lots and lots of them, and you just keep taking them until the pain goes away. It's real simple. This is out of an old text on how caries is, and I think this is very good support. What you see, I want to point at this one. What they call the translucent zone. And that is, the translucent zone is created by an outward alkaline flow from the immune cells that congregate but you see in the pictures and the observing, they didn't see the cytokines, they didn't see the lipopolysaccharides that moved down these tracks and attracted the macrophages. And then, this is acid decay. This little shallow lesion, that's caused by the acid on the outside. The deep penetrating lesion is caused by alkaline. If you get burned by pool bleach and you go to the emergency room, they don't even make you fill out the papers. They put you in the back and start washing out the wound right away. But if you spill your hydrochloric acid all over your arm, you got to fill all the papers out. Because acid forms a coagulum. It makes a shallow burn. It doesn't go deep. The only way you can penetrate and saponify is with alkalinity. So this just complicated words to support the immune hypothesis here that this is what really triggers it, this imbalance. And these are some cellular pictures. This is all out of, I just farmed some dental school, various libraries, and got these pictures to support my hypothesis, just looking at a slightly different way. So the adhesion, you can make a strep mutans that doesn't stick, and so it's less aggressive. This is also why I worry a little bit about our very fancy probiotics, where we're actually giving them high sticky characteristics so that they will live in our gut. And we're talking with Era, you get an awful lot of effects from just the cell wall lysates of bacteria or mitochondria or whatever organelle you're using. You don't necessarily have to have it alive and sticking and living on in your gut. So we may do better with some of the more traditional probiotics that weren't so sticky, because stickiness is a sign of pathogenicity. And so in my simplified way of looking at the world of scarcity and abundance, we have two basic gene programs, one for scarcity and one for abundance. And they're just processing all the information we're giving our genes, and then we get the result, either happy or sad, or firm or flab, or resilient or fragile, or high threshold, low threshold. It's all kind of goes together. And this is a slide that really talks about, I try to understand the two basic tracks to the nucleus of the cell. One are stress signals, which be viral, bacterial infection, reactive oxygen species, ages, advanced glycosylation end products, heavy metals. Those are all stress signals, and they cause the production of NF-kappa B, the upstream inflammatory chemical mediator, and all the other inflammation stems from that. And it changes our gene expression. 200 or 300 genes are changed when we trigger that. On the other hand, to balance that, there's something called the steroid receptor. And the steroid receptor is a dualistic receptor, and that takes the messages of abundance. And it always needs two things, vitamin D and a pigment. So vitamin D will tell the cell whether it's light or dark, and the pigment will tell you the season. Or it'll need thyroid hormone goes to this receptor. The steroid hormones go to this receptor. The fatty acids go to this receptor. Many essential oils go to this receptor. So you want to send a lot of messages of abundance to your genes so that it kind of cancels out the stress messages from our decadent civilization. So some of the things on this very complicated slide about the nuclear messaging, but this whole concept of the steroid receptor being the steroids, that's the nice stuff, you know, that's the pigments, the sunshine, the good fats and the good oils, that's all kind of happy messages, but also triggered by fasting, paradoxically, light, with our various light devices. These G proteins respond directly to light. Vitamins A, D, and K, all the fat-soluble vitamins, zinc, magnesium, hydrogen peroxide, ozone, N-acetylcysteine, all the retinoids, turpentine oil, limonene, carvone, bitter fennel, dill, coriander, peppermint, spearmint, DHEA, 7-keto DHEA, green tea again, EFAs, CLA, omega-6s, and I left out GLA. So those are all happy messages, not to be feared. If we get enough happy messages, then the body doesn't have to triage. It doesn't have to triage. It can let the defective cells die. It can let those white blood cells die at 3 days instead of living on creating chronic inflammation. And when they die, they don't create inflammation. This is a wonderful resource from a retired Harvard professor on the web. I put it on here, all about apoptosis. And this is really the difference of explosion with necrosis and organized repackaging with apoptosis. So this is what we don't want. We don't want our white blood cells exploding and releasing all their contents. We want them controlled cell death. And then necrosis is nasty. Now, there's different kinds of necrosis. There's liquefaction necrosis and coagulation necrosis. Those of us who have ever taken nerves out of dead teeth know that sometimes it's all mushy or air, sometimes there's, well, it depends whether it's death by too much acid or death by too much alkalinity. Either way is not good. So this is just another picture showing a shallow penetrating wound here that's kind of stopped, but then there's the messaging that went all the way down to the pulp through these, and every dental tubule's changed all the way down to the pulp, all the way down the pulp. It always goes all that way. And then another beautiful picture of the blebbing that occurs when there's apoptosis. And it's important for proper development as mitosis. Because during development, the autistic kids, they all have bigger brains. So during development, parts of the brain are supposed to die, switched off, and other things switched on, especially around age 2. But if the kid's getting a lot of stress from vaccinations or French fries, then that message may get canceled. With our chronic pain patients and TMJ patients, I mean, the ladies always had difficult menstrual cycles and everything. They were all stressed out, but we didn't really understand all the mechanisms. So, puffy gums, defects in apoptosis, even premature graying of the hair. I must say I'm very jealous of Hal Huggins. Enzymes, one of my favorite therapeutic tools. When I broke into dental practice, every time my dad did a dental surgery, he always prescribed bromelain. And I said, Dad, why do you do that? They taught us in pharmacology and dental school that these enzymes are an archaic therapy and they don't really work. Well, he says, well, son, you don't have to use them if you don't want to. Then he told me this story that when we first broke into Flint, Michigan there, he and his partner did these wholesale extractions on 200 patients and jammed in the immediate dentures. He says, you know, the patient's supposed to come back the day right after the surgery, but they couldn't. They were too sick. Inevitably, they were let in the second, the third, or the fourth day after the surgery by a family member because they were clinically blind. Their eyes were swollen shut. Then we were at lunch one day, and we were talking to the chiropractor about bromelain for sports injuries, and we decided to give our patients 2 bromelain before the surgery and 2 bromelain after the surgery. Son, it was like night and day. They walked in the next day on their own. We did 200 more patients that way. Then I moved to Miami to start saving teeth. So anyway, we've really evolved the use of enzymes. I have a whole page on them in the Green Book, and happy to send you, but they're just amazing. And they help cancer cells commit apoptosis. They help defective cells commit apoptosis. I remember once somebody came with a closed lock and a lot of pain and everything. I tried to manipulate them out, I couldn't. I gave them 10 enzymes, a glass of water, walked away, came back 20 minutes later, boom, boom, unlocked. Another favorite enzyme story is we use them a lot for sports injuries, and a friend of mine called me from the north coast of the Dominican Republic about 10 years ago at 1 o'clock right after lunch. He says, Steve, my ship's carpenter's just gone down with a stroke. Half his body is paralyzed. What should I do? I said, take him to a doctor. And there are no doctors. So I said, we got those enzymes? And these are the intenzymes, which are similar to wobenzymes. It's a combination of pancreatic enzymes from pig and some bromelain and papain and some chymotrypsin. I said, give him 10 enzymes every 2 hours. Well, he called me back the next day. After the 3rd dose of enzymes, the man's stroke cleared. He rested the rest of the day. He went back to work the next day. And we don't normally try those kinds of things. This is a slide I've had a long time. Patient, why are my gums shrinking? Why are they shrinking? Well, you're just giving your body too much stress messaging and not enough repair messaging. And basically, this is what cells do. With certain signals, they'll either kind of shrink and wane just a little bit, or they'll build up. This is this basic signal of live or die, of apoptosis. I think I have the reference to this on one of my other PowerPoints. I was asked for this. This is just a theme. But basically, if it's going to be hypertrophic or hypotrophic, it's going to be because of a group of cellular commands, of cytokines, of local hormones that are created by our genes in response to the messaging we give our genes. So why get all this complicated when we just have to treat give our steroid receptors more happy hits? Now, according to Bill, AA is a little bit less of a major player here in periodontal disease, but this is part of the armamentarium of the bacteria. So when the white blood cell goes after AA, it sends off a message, and the white blood cell commits hara-kiri, and the AA lives on. All kinds of, it's all about messaging. And what is a cleaning anyhow? What is a cleaning anyhow? It's just like the smallpox vaccination. You're taking some bacteria and things like that, and you're scraping it right through the skin. And actually, the smallpox vaccination is the only successful vaccination program ever because it arouses both cellular and humoral immunity. It arouses a balanced immune response. When you get a shot, it only arouses humoral immunity and creates imbalance in our immune system. So what we call a prophylaxis is actually a vaccination against our own bacteria. Think about it. And that was Roy Page that came up with that idea. That's what we're doing. We're messing with the immune system all the time. And we're the best immunologists. I mean, we have this instant feedback. I had a lady come to me for consultation just for nutritional stuff, and she ended up seeing Nick Gonzalez, a disciple of William Donald Kelly in New York. And she came back a year later looking 10 years younger, tan, toned, terrific, and all her cancer markers from 90s to 10s. And she'd all done with diet and lifestyle. And I said, you don't have to do all these expensive tests now to follow how you're doing. You can just follow the plaque in your mouth. If you're forming a lot of plaque in your mouth, you don't have good cellular immunity, you're at risk. But if the mouth is staying clean almost effortlessly, you're cool. She says, oh! She did, I'd like to do this. She did one of these. Just 6 months before I discovered my breast cancer, I had so much extra plaque forming in my mouth. And a very conscious dentist she was seeing had decided to increase the frequency of a recall to every 3 months. I mean, I did that so many times before I had this little awareness that this is really an alarming thing, plaque buildup in the mouth. It's big failure of the pancreas and of cellular immunity. And without that, you're really at risk. And without those pancreatic enzymes, your blood's a lot more sludgy too. That hypercoagulability thing that we keep talking about is the underlying risk to pretty much all of the symptomatology we see. Insulin itself is a stressful hormone. People that take a lot of insulin for diabetes, actually we've been using something called pancreas tonic. It's a 4,000-year-old Ayurvedic formula, and we've gotten, 10 or 15 people completely off their insulin. And a couple of people actually have come in and announced that they're no longer diabetics, and this is the only thing they take. But we don't want to trigger insulin, and that means high glycemic foods. So we got to watch away for the high glycemic foods, and one of the ahas was all the high glycemic foods are all the toasted sugar products and French fries. So sugar is bad. Toasted sugar is very, very, very bad. It's 1,000 times more active to our genes. Why do we like this caramel so much, this taste so much? Why do we like this terrible stress so much? It's because of a hormetic effect. A tiny bit of stress is actually good for us and tones the system and gives us greater adaptive capacity to stresses. But when we overwhelm it, then there's the parabolic dose response curve, and then it becomes overwhelming. And one thing man can do is burn things and cook things. We've learned that a long time ago, and it's a pretty easy way to make things addictive, which is good for business. This is the classic Vipholm study. It was done 1946 to 1951. They totally controlled the diets. They gave them chocolate, sucrose, bread. It didn't really raise the caries very much. But toffee or caramel, you can see the difference in slopes of those three. Much worse. It's toasted sugar that's worse than sugar. This is another major theory on tooth decay, the calcium-phosphorus ratio in the diet. They looked at all the variables, and all they could find is the calcium-phosphorus ratio. If it was off too far one way or the other, people would have caries and would have breakdown. And this is a combination of veterinarian and human slides and information. But basically, if you eat too much meat and soda pop, you're going to get tremendous amounts of decay one side. And if you're too strict of a vegan, you're going to get decay on the other side. Somewhere in the middle is the best plan. Then if you don't have enough calcium, if you don't have enough magnesium, or if you have excessive phosphorus around, the parathyroids will trigger to take calcium and stuff out of the bones. And the parathyroid is one of 18 different beta-adrenergic hormones, and it's the beta blockers that are so popular by the physicians to make their patients compliant before they sign their forms. And for, I guess, a few other reasons they use the beta blockers. But nutritional hyperparathyroidism causes that wiggly teeth. So the first when they don't have enough minerals, first the teeth get sensitive, and then they start to get that subtle mobility, especially the two lower first incisors. There's the first ones that get a little extra mobile. We call it fremitus. And as soon as I see that, I know that person's in negative mineral balance, because I did bone densitometry in all my patients for 3 years, about 30 years ago. And I found out I didn't need to take the x-ray anymore. I could just see how tight their teeth were. If their teeth are really tight everywhere, they're building bone. If as soon as they get that little bit of mobility, those lower two front teeth, they always come back with their special osteopenia reports from their physician and their checkups. So this creates the irritability. Kids getting cavities are irritable. And the key thing is breakfast. And breakfast really needs to be before 9:30, before 9. Probably even 8:30 is a little bit late, to stay on the daily tidal rhythm, to keep in sync with the tides. And this is just the key. Leo, you've got that book, the guy that got the heart attack with the red cover, at the DAMS booth. And right in the first thing he says, the day I had the heart attack, I didn't have time for breakfast. And then he got his heart attack. So we're really, that's a major time when the body wants to build and repair. And unless we put what I call a sustainable breakfast in our stomach early in the day, the body will not build and repair. The body will go into reverse. It'll go into a catabolic state when it's not supposed to. Then all the cycles of the next 24 hours are messed up. You're permanently in jet lag, permanently swimming against the tide. Got to have breakfast. And it's all based, I took a seminar from Elias Ilyich from Diagnostics, who was one of the first ones to do salivary hormone testing many, many years ago. In his first 3,500 patients he did, he found that this rhythm was the key thing to any degenerative disease. And that's what TMJ and periodontal disease and caries, those are degenerative diseases. And unless people are in rhythm, unless cortisol goes really, really low at night, then the white blood cells will not come out and play. White blood cells do not gobble if there's stress around. They go and stay in the spleen. And so the street, like I use the street cleaner metaphor. It's like the street cleaners coming out at night in a big city going all around clean. Well, if there's too much sugar, if we ate too much late at night, we drive our blood sugar up. The whole time blood sugar's coming down. There's stress hormones being released. Because we're a rainforest system, and we lived in the rainforest, nothing would ever hardly drive our blood sugar up very high. So if blood sugar ever dropped, it meant there's a major metabolic emergency. The body does not read levels, it reads rates of change. So if you drive your blood sugar up to 200 with your evening snack, the whole time it's coming down, you're releasing stress hormones, you don't get your nighttime cellular repair. Major, major thing not to eat 3 hours before bed and to have a sustaining breakfast early. And then this controlling glycemic index, it's not quite that simple. They gave a whole bunch of people apple pie expecting to see their blood sugars go right through the ceiling, and nothing happened. Their blood sugars all remained flat. Well, there was cinnamon on the apple pie. Hot potatoes will drive your blood sugar high. Cold potatoes will not. So vichyssoise should be always served cold. So a hot potato, a hot baked potato with nothing added will drive your blood sugar right through the ceiling. But you have that, make a potato salad out of the same thing you eat the next day, it doesn't do anything to your blood sugar. A lot of it is the micronutrients, and we're finding the pigments are super, super important. The things in ginger, the things in basil, the cinnamon, that pancreas tonic, that 8,000 or the 4,000-year-old formula using common herbs. One of them is cinnamon. And then I have a special interest in nerves because of TMJ and all, and neuropathy. A lot of people come to me with various neuropathies and stuff. I have a 70-page PowerPoint on neuropathy, if anybody wants to hear it. But we found out that certain of our herbs actually have nerve growth factor in them. We work like the plants. So by taking these things, we can help repair our nerves when they're damaged or if we've done a surgery or whatever. And then we always got to look for B12. This is a really big thing. I had a 84-year-old lady who had the red beefy tongue and everything else, and she was getting older, and suggested she take some B12. And we have these chewable ones that are sublingual, and they're about 87,000 times the daily requirement, figuring that maybe 0.5% will get through by mass action. And she came back a few weeks saying, you know, one of these just doesn't work. It takes 5. So it's actually a biotics product that we like a lot, a chewable B12 with a little B6 and folic acid. And sometimes and actually I found over and over and over again that you just don't have to be afraid of overdosing B12. There's just no way of overdosing B12. Selenium and B12? Well, I pretty much started everybody with the minerals already. The multi-minerals morning, night, including that selenium. That's the base. I don't even talk to anybody until we do that. So it's just real important for nerves. So if they're spacey, if they're not paying attention, if they're having pain of almost any kind, you got to think of B12. And if they have their red beefy tongue. And this is the stuff about AGE's, Advanced Glycosylation End Products, which is a fancy name for toast. And they're also called acrylamides or polyacrylamides. They're well-known carcinogens from the water flocculating industry. In 2002, the World Health Organization announced that they discovered this carcinogen in foods. And it was very rich in things like French fries. And the American manufacturers have done everything they can to hide anything about this. But key, if you bake, it should be baked under 365. And if you're going to brown anything, don't brown it. Turn it to a golden yellow. Don't go all the way to brown. So then you'll have a whole lot less of these advanced glycosylation end products. This is a major characteristic of all the boxed breakfast cereals. I have 4 grandchildren. I don't mind teaspoonfuls of sugar. I freak out if they get Cheerios. Periodontal disease is autoimmune. And it's very much like rheumatoid arthritis, which is a classic autoimmune disease, and the cytokines are almost exactly the same. And I just saw again this last week. This I think is really a big aha. Pretty much the prevalence of adult periodontal disease follows the prevalence of enamel pearls. And enamel pearls are remnants of the ectodermal guiding cells that form the root. Usually ages 4 to 10, peaking at ages 5 to 7. That's when the roots of the bicuspids and molars in the posterior are mostly formed. And that's where the progression of periodontal disease is mostly. And Dr. Huggins was talking about the antigenicity of an ectodermal cell on the inside of the body triggering the immune system. So we now have discovered enamel pearls, restive maliceae, in the crotch of molars, along the sides of bis. And I believe that when we disable our cellular immunity and the body turns on its humoral immunity, it discovers these little bits of cells that were supposed to die when the kid was 6 years old, but he was eating too much French toast and French fries. And those cells didn't die on time, so they remain alive. And then they're triggered later on to create periodontal disease. This is actually in the literature. This is not something I made up. I found it in the literature. So and it really seems to follow that. And what is the second biggest stress in a person's life? Ages 5 to 7, the second biggest programmed growth spurt. And these kids are just, well, developmentally, they asked Harvard Women's Mothers Group how often their little girls ages 1 to 5 had French fries. And then they tracked these ladies as they became adults and found what percentage of them got breast cancer. Each serving of French fries per week, ages 1 to 5, increase risk of breast cancer by 27%. So those developmental years are important. So enamel is indeed anagenic. It's all through the literature. And you can actually classify periodontal defects according to how deep the enamel goes into the furcation. And periodontists know if they're not ripping them out, putting in implants, that if they grind away that enamel in the furcation and they put something over it, the bone, it'll grow back. So if you don't have cellular immunity, Th1, then your body has to turn on Th2, which is the humoral immunity, which is the antibodies, the allergies, the hay fever, and all that. And here, stimulation of that increases caries frequency. Here's diminished cellular immunity. It slows phagocytosis of damaged cells. So that's what happens when an apoptotic cell dies. It's supposed to be gobbled up by friendly white blood cells, and then all those parts redistributed. But if they're damaged, then that doesn't work. And then we forget about the viruses, because it's the viruses that change the bacteria. They're the bacterial parasites. So a virus can take a benign strep in your mouth and make it a pernicious strep in your mouth. It's the viruses, that other level that we ignore. And that really tiny bacteria that we saw on the slide, the H. pylori. Well, look how prevalent it is. It's found in ulcers. And what are bleeding gums? Little microscopic ulcers. So you'll see atrophic gastritis, low stomach acid, diminished absorption due to low acid, low B12 absorption due to that, iron, minerals, and more, low platelets and bleeding gums, rosacea. People with chronic rosacea very, very often have an underlying undiagnosed Helicobacter pylori infection. And any autoimmune disease might be related to that. And I know we had this wonderful lecture on not only mercury causing everything bad, but parasites causing everything bad. Well, this is a very tiny parasite. And then these are the bugs that make the arteries and the gums worse. These are the ones that are the most, and we keep focusing on the germs, and we forget about the viruses, because they're harder to follow. So the more pathogenic somebody's gums or arteries are, very likely they're having a viral problem. How are you going to control that? Restore cellular immunity. The cellular immunity takes care of the viruses, the yeast, and the bacteria. We can't keep killing all these things. Kill, 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 kill. So it's the viruses. And here's, we've been hit over the head with the correlation. And I say very simply to my patients, being the holistic dentist, all the tubes in the body are designed the same way. The mouth is the opening of a tube that runs down the middle of the body. Arteries are tubes. Veins are tubes. Ducts are tubes. Even glands are closed-end tubes. They all work the same way. If this tube is collecting a bad biofilm, so are all your other tubes. If this tube's going to spasms, so are your other tubes. They understand that one. I do a lot on this methylation defects because I'm basically a spina bifida baby, and part of the reason I'm so conservative in my approach to dentistry is it's always hurt me to do the work. So I would never, ever dream of doing anything unnecessary unless we absolutely had to. So I'm what they call a spina bifida occulta, which is I don't have major problems, just a little split in the bottom of my vertebrae and just a higher risk to heart disease, stroke, and cancer, and other kinds of things like that. But I didn't die as an infant or anything, and I even know when to pee most of the time. So, but methylation defects, this underlying weakness in me being able to recycle folic acid effectively, which is one of the important cogs of recycling glutathione and does some other important things, sets me up for a whole lot of different things. And so we're going away from the age of descriptive medicine, where we just described everything in Latin, read to the patient whatever symptoms they had back to them, into actually looking at the genes and correcting the underlying metabolic defects that lead to the disease. So methylation defects usually show up on the tongue because that person's a lot more stressed out, and that's when you start to see the balding tongue, the strawberry spots. These are the things that we used to always associate just with these B vitamin deficiencies, the methylating B vitamins. Now we understand it as a measure of apoptosis, actually a measure of how much stress this whole system's getting, depending on if we have that nice shag carpeting of a tongue, or a thinning shag carpeting, a little red tip, or lots and lots of taste buds, the survival cells showing through the mechanical taste buds. They're not taste buds, the mechanical rasps we call filiform papillae. So you have these two different basic structure functions right on top of the tongue. The structural mechanical reservoir cell, which is the mechanical rasp we call the filiform papillae, and underneath the survival cell, the taste bud with the nerves in it. So when we can start to see those survival cells showing, oh, they're in survival mode. They're triaging. They're letting structure wane, and they won't be a successful patient unless you get them to change their rhythms. So these are the classic methylating B vitamins: B6, B12, choline, trimethylglycine, DMG, which the Russians used during the Olympics, pangamic acid, and folic acid. So the sore tongue, any pain, and there's something called co-methyltransferase. That's has to do that. For a while they called that the pain gene. If we have a good one, a medium one, or a slow one, and but these are all the signs we're just talking about, as well as diarrhea, cracking at the corners of the mouth. These are all signs of missing methylation. You can't just say it's one B vitamin because there's these four or five major methylators. And being a TMJ doc a long time ago, this is very interesting because people, actually, Emmanuel Tarascon used to always talk about René Dubois, and this is another lovely one I use with my patients. It's as though there were three dolls: a steel doll, a celluloid doll, and a plastic doll. And each doll received exactly the same stimulus: a small tap with a ball-peen hammer. The metal doll lets out a resounding sound. The celluloid doll dents, and the glass doll shatters. What kind of a doll are you? So, and this variant in the COMT enzyme has a lot to do with that because it controls the levels of dopamine and those kinds of chemicals in the brain, which are real important for alertness and coping with pain. And if those go away too fast, you don't cope very well. So it actually, it's a neat thing. And the COMT gene is also used for detoxification as well as for controlling your brain chemistry. So the perfect pain person would have low body temperature, poor detoxification with constipation, stimulant stress and sugar addiction, poor barriers allowing antigenic bloat. When we make a big deal out of scalloped tongue, and that's a bloated tongue, and that's poor stomach barriers, and that's a whole system in major distress because the body's not controlling water in its various pools very well anymore. So we think that's a big sign, is bloated, real fat tongue or real scalloped tongue. They've lost control of their stomach barrier. There is a difference between girls and boys. Testosterone does protect against autoimmune disease, although the boys get a lot more autism. The girls get more tooth decay even though they take better care of their teeth. And they get more gum disease even though they take better care of their teeth. One of the big discoveries was that AGEs, advanced glycosylation end products, were to the cell, to the nucleus of the cell, the same as heat shock protein. And the concept of heat shock protein is a little bit of it will make us strong. Too much of it will overwhelm us. So we all know about burn patients. If you get burned over more than a certain percentage of your body, it's almost impossible to save the person because of the heat shock protein creating an overwhelming shock in the body. But small amounts actually end up making us stronger and we heal better and faster. And so a little tiny bit's almost desirable, where large amounts are very disabling. And this is just one of those things that there weren't very many toasted sugar products around when this system was devised. The omega-3s, they soften that estrogen signaling. The evening primrose oil, blackcurrant oil, borage oils, they promote the omega-1s. That's that EPA part that I was talking about before, where you need 2/3 EPA and DHA and 1/3 GLA. This is the GLA. And decreasing testosterone boosts autoimmunity. When I was discovered to have lymphoma and having lots of trouble and feeling really old, I went to the anti-aging doctor, and he tested me, and I had the testosterone of a 91-year-old man. And so we began, among other things, to restore DHA and pregnenolone and some testosterone. And before long, my disease went back to the same level that it used to be when I had testosterone. What a coincidence. So look at your men. If they don't have much hair on their arms, if it's fading away, then they don't have enough testosterone. Celiac disease, big thing. I've had trouble with wheat, but we can have trouble with almost any of these modern grains. And I believe the reason celiac disease is growing when it's theoretically just a genetic disease is because of the toasting, the crisping, the caramelizing of the wheat molecule, which makes it a stressful molecule, and then we keep giving it to people, and after a while people's immune systems don't like it anymore. So the big concept right now is that when you take resveratrol, the pigment that's in the finicky Pinot Noir grape, so it's a hard grape to grow, so when it's growing it's always under a lot of stress. So that's what you want to eat. You want to eat organic things that have been stressed by nature, maybe had a few bugs, that had a struggle to get enough nitrogen, because they'll make more of the little microscopic stress chemicals that'll tell our genes that, hey, this is just a little bit of stress from nature, and we want you to respond in a hormetic fashion, hormesis, and that's going to make your whole system adaptive and stronger. So now they take the rats, and they feed them the standard American diet, and they get fat and corpulent and get heart attacks. Then they take the rats and give them a little bit of resveratrol, this special little stress pigment from plants, and they give them the same American diet, and they're thin and lean and happy and having a good time. It's all in the pigments, the messaging that comes with the food. We didn't talk a whole lot about lead. I view lead and mercury as essentially the same thing, just mercury is a slightly more dangerous version of lead because it vaporizes more easily. But if you look at the studies, what takes them in and takes them out, and of course the awful synergy that we heard about, the 100-time synergy, it's really big, and it's still very big. And we have to remember about lead, and this is actual out of the dental literature showing that lead increases cavities. And of course, this is a little Boyd-Haley slide and mercury in the microtubules. And this is a Medscape slide about how diabetes, metabolic syndrome X, what I call the survival syndrome, evolves. And all the different things that happen to our vasculature, endothelium. And we're really mostly talking everywhere about endothelium, 50,000 miles of arteries and stuff we have. That's the biggest tissue. That's where the pain comes from. Mark Houston has got some wonderful work, a physician from Texas. And as far as dying from a heart attack, the DASH diet is by far and away the most important thing. And that's a lot of whole grains and not too much meat, and that really is a big shift. Magnesium's important, calcium, potassium, not so much alcohol. But those are all nice, but wow, 6% for fish oils. Decrease sodium, 6%. Decrease weight, 8%. Now, I really believe that's firm or flab. It's not just weight. You have to either, you're going to be flabby or you're going to be firm. And so if you're giving your body hibernation messaging, you're going to be flabby. And if you're giving your body springtime messaging, you're going to be firm. Practically everybody who comes to us in pain is in adrenal exhaustion. All those people with bloated tongues, they're in adrenal exhaustion. And if you're adrenal exhaustion, the thyroid doesn't work very well. And then, of course, that's the not enough metabolism, is the underlying cause of puffy gums or pain. I like to think that we have three immune barriers. The electromagnetic, depending entirely on our energy, and it's low if we have sensitive teeth, puffy gums, pain, or TMJ. The physical, which is fibrous, like our mobile teeth and bleeding gums. So the electromagnetic is dependent on the minerals and good cell membranes. That makes the strong electrical charge of the cell. Physical fibrous, well, that's the vitamin C. Over here I have the lingual ascorbic acid test, which is also the reduced glutathione test that we've been looking for, and you have a separate article in the back all about that, how I discovered that and how I've been using it for 40 years, and how we'll simply not enter into therapeutic work with the patient, even examine them until I know their redox status, whether they have enough glutathione to protect themselves against me. And then cellular immunity, the gobbler cells. And they're actually, the outer layer is the gobbler cells and the bacteria. The outer layer of our immune system is really the bacteria, our friendly bacteria. They're the outer layer. And they tell our immune cells what to do. And they're the most sensitive and reliable indicator. And I believe that the microscope is the only proactive tool that we have. Everything else is after the fact. But you can tell if somebody's got scary bacteria just with a plaque sample so easily. And it's surprisingly healthy people. The people, often the ones that are eating the most healthy diets, paying the most attention to their diet, but they're just having fruit for breakfast, and it doesn't sustain their immune system. So in our office, we think that plaque is evidence of failed immunity. You cannot maintain health by brushing and flossing. We check health by brushing and flossing. So I love the microscopic evaluation of plaque. Are there dark shadows under the eyes? Or a toxemia rash, like the lupus butterfly rash? That's a toxemia rash. And those are allergic shiners. So those are people who are eating, who have turned on their humoral immunity. Now they're allergic and hypersensitive. Flakes or redness around the ale of the nose. That's very, very commonly poor phosphorylation or B6. Dry, dented, or chapped lips. Dry elbow skin. Essential fatty acids. It's such a common insufficiency. People with dry, chapped lips don't have enough fat. They don't have enough oil on the surface to keep the water in. Another major fun, I really think I forget. You know those ones that always have the water bottle? The ones that actually drink 8 glasses of water a day? How many people here actually drink 8 glasses of water a day? Like we're supposed to? Oh. Okay. So I think the only ones that actually drink 8 glasses of water a day are the ones that are deficient in essential fatty acids. Because if you don't have enough oil in your skin, it's like saran wrap. That's what keeps the water in. So if you don't have enough essential fatty acids, you're always thirsty. And your lips are dry, and you get the alligator skin and stuff like that. The phrenums, I was taught this by Dr. Chi. You know, in healthy people, those phrenums are knife edge. They're just really, but in unhealthy people, they're fluffy or they have bubbles and stuff. And Dr. Chi says that that reflects the bowels. The phrenums are a Chinese thing that reflect the bowels. So if they're fluffy or bumpy, then you've got fluffy bowels. That means gas and bloating after meals. And I swear, I do that in doing the oral exam. I say, oh, you got a lot of gas and bloating after meals? And they look at me, how did you know that? You know? I call that setting the hook. And how coated is that tongue? If it's really coated, it's probably a lot of yeast. Because the first loss of grace after they lose those coccygean rods is always yeast. And yeast can actually be beneficial. Yeast makes vitamin C for us. So I have many patients that make a little extra yeasty plaque and are fine for 30 years. And they don't eat very many vegetables, and they always test pretty well, and they have a pretty good immune system. They found their little balance. It's only when we've lost our cellular immunity completely and turn on the allergies that we become allergic to the resident yeast, and that's when the yeast is a problem. So our tongue, well, that really tells us whether that patient is triaging or not, and that vitamin C test really tells you whether you should work on them right now or not. And I feel that our patients do very well without IVCs because we give them, make sure they're adequate before we work on them, and we don't have to rescue them after. And we can do it all orally with just oral preparations without having to puncture a lot of veins. Now, there are some very sick people that need those extreme measures, there's no doubt. But most of the time, it's not necessary. I celebrate tight teeth when I find them in a patient. And when I find slightly wiggly teeth, I start talking to them about their irritable feelings and how they have to control their emotions and how the whole world's moving a little bit too slow for them. And since probably the major thing I do is change old mercuries into new composites, the most common thing you see developmentally is what I call the two-stage occlusion, the underdeveloped mandible, because the person never ate all the whole foods that Weston Price recommended, and they didn't develop to their full genetic potential, and they had some crowded teeth, and the lower six incisors are up high, and the lower posterior teeth are down like a step. And they have that little click in their jaw. So after I finished completely replacing 4 quadrants of amalgams, the patient still had the click in the jaw. And I had worked so hard to get the bite back just the way it was before. And I realized if I just lift all those fillings just that 0.5 millimeter thicker, the click would have been gone. So now I really take pains to look for that click, and especially in the stage 2, if I'm going to be changing those fillings. If it's not too big a deal, if I only have to change the occlusion to 0.5 millimeter or a millimeter, you can do that with the bondings. You know, it's not a big deal. And I say, nurse, can I have a bifold towel, please? And we rip off a little piece, we put on both sides, and the click goes away, and the lips look better, and the face looks better. Well, hey, we want to go there. We call that the dental facelift. So, okay. We have a couple minutes. The handouts in the back, I think, are really, really nice. The one is the rhythm that I give my patients, and hopefully you'll take these little high points I gave you, and with those